Ladies and gentlemen, we back to your screen, live screen, again with Dr. Cem Alay from Eskişehir city. As I mentioned yesterday, Eskişehir is looking like and more than beautiful than Venice. You don't need to go to Venice. You can go to Eskişehir and you can do your eye surgeries in Eskişehir Ophthalmology Center, and you can enjoy Venice, Eskişehir, Turkey as well. Dr. Cem Alay, please go ahead with your screen sharing and share your presentation with us.
Thank you very much, Mr. Chakmak. It's an honor for me to be here. Firstly, I want to thank to the committee for letting me this chance, sharing these great moments with all you beautiful people on this beautiful Saturday afternoon. I want to thank you. I'm gonna just try to tell you about refractive surgery and premium cataract surgery.
We are waiting to screen share.
Yes.
Share screen, please. Okay, it's come.
Okay.
Page, please.
Yes.
All right, you can go ahead.
Thank you. I'm Dr. Cem Alay, and I work in ESKISEHIR Private Ophthalmology Center. As I mentioned before, I'm gonna try to tell you about refractive surgery and premium cataract surgery, basically. First of all, I want to emphasize that I have no financial disclosure or conflicts of interests. Let me tell you about our hospital a little bit. We have been providing eye health services for more than 10 years in Eskişehir, which is a lovely city in the Middle Anatolian region. We are basically an outpatient service, and we have 5 experienced ophthalmologists and 1 anesthesiology specialist. We have examination rooms equipped with modern equipments, and we have contact lens units and modern operation room and excimer laser unit also. Here are some lovely photographs from our hospital. And what are we dealing with? We're dealing with refractive surgery, cataract surgery, and also we are working in the area of oculoplastic surgery, glaucoma, medical retina, ocular surface problems and infectious diseases, and pediatric ophthalmology. But I'm gonna try to tell you about refractive surgery and cataract surgery, which is the most frequent procedures done in our center. Let's start with the refractive surgery. It is a method which is worldwide usually known and applied for the people who wants a spectacle-free life. And we can just perform this procedure from the age of 18. And we can correct up to 8 diopters of myopia, 6 diopters of astigmatism, and 4 diopters of hyperopia. After a full detailed examination, we should decide the method we will do. We could prefer LASIK. Mostly we just perform LASIK. Also, we can do some LASIK or PRK to correct those refractive errors. So we just decide the method in order to the patient. When we make our decision, we just use the corneal tomography, and we have Pentacam in our clinic. It's a Scheimpflug-based imaging system which provides detailed information about the ocular surface, especially about the cornea. And also we have some aberrometrical diagnostic tools to determine the high-order aberrations, because it's very important to determine also the aberrations, which affects the quality of vision also. And we can also perform topo-guided treatment or wavefront guided treatment in order to correct those aberrations, and that would provide us a better quality of vision also. Sometimes we just exceed the limits of the possible limits for correcting the refractive orders with the excimer laser. So sometimes we just try to correct those refractive errors with another method, and it is called as implantable contact lenses. It's just an intraocular lens also, but it is just made of some material called polymer. And it is also a very safe and quick procedure for appropriate eyes. And we can just correct the high myopia, mostly we could do for that high myopia, and we can also correct hyperopia and astigmatism with this procedure. Now we can see the implantable polymer lens in the eye from the schematic. As you see, there is an implantable intraocular lens just between the iris tissue and the original crystalline lens of the patient. By the help of this tool, we can correct very high refractive errors for the appropriate eyes, of course. Here you can see the laser, and here you can see the happy patient. Yes, that is the picture at the end of the procedure. Mostly, we just make our patients very happy with this successful procedure. Of course, there are some complications. One of my, as one of my mentors says always, if there is surgery, there's complications. So we have some complications too. That's not so easy. There are some flap-related complications as free flaps, spinal flaps, incompleted flaps, or we come across like dry eyes, epithelial ingrowth, undercorrection and overcorrection, and as you see, lots of complications. But by the help of the diagnostic tools and the experience, we just rarely see those complications. But even if we come across those complications, we're just very able to manage them too. Let's pass to the cataract. Cataract is just, as you always know, just one of the leading causes of blindness worldwide. And with the help of the modern diagnostic equipments and surgery techniques, we are able to get the most satisfying results possible. In terms of the recent technology, by the help of the recent technology, conventional cataract surgery has been evolving into a refractive surgery also for the recent years. So some other intraocular lenses, some high-tech, high technology intraocular lenses were also invented. Those are basically premium intraocular lenses with the general caption. We have trifocal lenses, which corrects far, intermediate, and near vision. And we have some enhanced depth of focus lenses. We have some toric lenses, which provides astigmatical correction. And we have some other specific lenses, which can be named as monofocal, which can be locate the lens between monofocal and EDOF lenses. And also, we should note that toric versions of the trifocal intraocular lenses can also be chosen according to the patient examination results. Of course, sometimes cataract surgery can be complicated too, and maybe intraocular lens cannot be implanted in the first session. In this occasion, the patient will become aphakic. So there are several solutions in order to manage this situation, and we have some secondary IOL implantation procedures such as scleral sutured IOLs, iris sutured IOLs, iris clove IOLs, and we have some scleral fixated IOLs too, in order to manage this situation also. Here you see a picture of this standard cataract procedure, and you are seeing those two machines we have been using in order to perform cataract surgeries. Here are some photos of the premium intraocular lenses. For example, this one, this model has two notches, two markings on its ocular surface, as you see. These are the toric marks, and we just put the lens in the eye with the correct position, and we can just handle the astigmatism without any spectacles postoperatively. And also those ones, you know, those ones, as you see, with those are the trifocal lenses, and this one is too. There are some circles, as you see, on the ocular surface, and those circles compose multiple focuses in the eye, and those focuses let us a spectacle-free life, basically. And now you can see the two pictures with our patients. One of them is a toric patient. As you see, this is the preoperative plan. We just the markings. Maybe you remember in this slide before. We just planning to put this IOL in the eye with the correct position. As you see, it is just located just in the position we planned at 70 degrees. So this is a toric lens. And this on the right side, you can see the trifocal intraocular lens. And as you see, it is just well centered and well positioned too. Of course, there are complications too in the cataract surgery, like wound leak, descents, or intraocular pressures, endophthalmitis, pupillary capsule, and IOL decentration. Those are also are very possible to come across, but we can manage them also very well. Besides those surgeries, we have some oculoplastic procedures for eyelid surgeries like upper and lower blepharoplasty, ptosis surgery, entropion, ectropion repair, or we can perform some lacrimal drainage system surgeries, and we can also do some buttock surgeries too. Also, we can come across like those diseases like glaucoma, and several procedures can be done in our clinic too. And it is a very important clinical disease that usually is symptomatic, but it is just a progressive optic neuropathy which causes permanent visual loss. And so it's very important. We can come across those situations after cataract surgery also. And we can just have some great diagnostic tools to detect glaucoma in the early stages also. Also, we can manage some medical retinal diseases like diabetic retinopathy, age-related macular degeneration, and retinal vascular problems. As I mentioned before, we can also have some pediatric ophthalmology procedures like routine eye examinations or strabismal surgery or amblyopia treatment. Keratoconus is just another disease we can come across too. It is just a disorder of the eye which results in progressive thinning of the cornea, which leads to deterioration in visual acuity also, and usually starts and progresses in early adolescence. So it's very important to detect that too. And high myopia and astigmatism, which cannot be corrected with spectacles or soft contact lenses. And we can just perform corneal cross-linking, some sort of laser, and intracorneal ring segment implantations too. Thank you for your patience and your cooperation.
Thank you, Dr. Cem Alay, for your lovely presentation. Yes, thank you for stop sharing. There is several questions come from audience, especially about cornea transplantation. Do your institution can do cornea transplantation as well?
Unfortunately not. We have just, first of all, in our country, there are some rules, and you have some corneal bank. So, and you have to get those permissions to do this implantation and corneal implantation. Unfortunately, we do not have those permissions to perform those surgeries right now.
Good. Second question, that there were more than 200 ophthalmologists, doctors from the region, 13 CIS countries, was listening to your presentation, and they mostly they are asking if they can come to your hospital and get some education for cataract surgeries and for LASIK laser surgeries. Education practically as well as possible or not?
I wish we had those people all around the world, but unfortunately we are not able to do that also. But maybe in the future we can be able to do that. I would love to share the experience and teach all our colleagues across the world. It will be an honor for me, but unfortunately we are not able to do that.
Not able to that. Okay.
Sorry.
Right. So
sorry.
That was two questions come from the audience. They are thanking a lot for your comprehensive presentation and thanking for being with us, your valuable time as well. And we are hoping to see you in our next virtual event and webinars that we can able to share your experience and knowledge and know-how with other colleagues from other countries. Thank you.
That would be an honor for me, sir. Thanks a lot. Thank you very much. Thank you.